Suboxone side effects. Suboxone is a medication used for opioid dependence treatment that comes as a sublingual film or pill that dissolves under the tongue. It usually is part of medication-assisted treatment, or MAT, that combines it with counseling and behavioral therapies to treat opioid withdrawal symptoms and opioid addiction. In some cases, it is used to manage chronic pain. Suboxone has two active ingredients, buprenorphine and naloxone. Buprenorphine is an opioid partial agonist which activates the same receptors in the brain as other opioids but with a much weaker effect. Naloxone, on the other hand, is an opioid agonist which blocks the effects of opioids. It can reduce cravings as it does not produce a euphoric state that results in opioid addiction. It can also help prevent withdrawal symptoms. Suboxone is a great help for those looking to recover from opioid use disorders or those dependent on opioids, which can cause several side effects. Its adverse side effects vary depending on their addiction level and how their body metabolizes the medication. It includes how long this person has been dependent on long-acting opioids and how much they have been taking in a certain amount of time that can lead to acute withdrawal. This measure of time is called the window of efficacy. The window of efficacy is different for everyone. It may be as short as a few hours or as long as a few days. Side effects can occur in some people. There are varying levels and degrees of side effects. However, if a potential side effect of Suboxone is causing any type of pain or discomfort, or does not subside, contact your Suboxone doctor or healthcare provider immediately. The most common side effects of Suboxone are mild and may include headaches, nausea or vomiting, constipation, sweating, dizziness or lightheadedness, drowsiness or fatigue. Some of these common side effects are different depending on the patient. Some may experience severe side effects, while others may experience none at all. However, the fear of side effects should never discourage you from starting Suboxone treatment for opioid use disorder. Controlling opioid withdrawal symptoms can be eased with the help of a Suboxone provider. Should there be a medical emergency or possible risk of overdose apparent after taking Suboxone, call 911 and your healthcare professionals. Here are some signs of Suboxone overdose: slow or shallow breathing, loss of consciousness, constricted or small pupils, cold, clammy skin. It is crucial to understand that Suboxone comes as a prescription medication that, much like most drugs, shouldn't be turned into a cocktail by mixing opioid medications. Severe side effects can occur when you misuse Suboxone by interacting with other medications and substances. Therefore, telling your doctor about everything you're taking before starting treatment is vital. It includes prescription drugs, over-the-counter medicines, vitamins, and herbal supplements. It's also essential to avoid using alcohol or illicit drugs while taking Suboxone, as it can increase your risk of overdose. Opioid overdose is not something that should be taken lightly. If you or someone you know is misusing Suboxone, please seek help. Many resources are available to those struggling with devastating opioid effects and addiction. You are not alone in this fight. Suboxone is safe and effective for treating opioid dependence when used as directed in a complete treatment program. However, like all medications, it has the potential for mild and severe side effects. Talk to your doctor about any concerns and follow their instructions per taking Suboxone to minimize the risk of experiencing any adverse effects.